I was actually born at Yale, and I worked there for 10 years as a janitor there. And during that time, my mom got sick. I seen her deal with healthcare disparities when she was sick, and just seeing the CEO at the time help me when my mom was going through her disparities is what pushed me to want to become a doctor and help people that were like my mom.
Welcome back to another episode of the podcast for doctors by doctors. I'm Dr. Michael Jerkins, your host today. We have never had a guest like this on. I don't think there's actually a guest like this that's even available across the country. That is a very unique story. That is a medical student about to graduate, matched into anesthesia residency, but not just any anesthesia residency. It's actually at a hospital that she previously had worked at as a janitor and had I always think medical students that have other experience before medical school really stand out in residency and in training. And she is no exception to that. Just so happens that she also worked at the place that she's going to be training to become an anesthesiologist, which is super unique and very cool. I'm really excited to hear about her story and where her career is going to continue to take her. And she's been all over. I mean, she's been on lots of shows, other podcasts. She is a very popular guest because of how inspirational and unique her story is and how hard she's worked to get where she is today. So I will stop yapping and we'll get to our guest. Today on the podcast for Doctors by Doctors, we are joined by Dr. Shay Taylor-Allen. From hospital janitor to physician, today's guest is the definition of full circle. Dr. Shay Taylor-Allen graduated from Howard University College of Medicine and matched at her first choice, Yale Anesthesiology. Born at Yale and having spent over a decade working there as a janitor, she now returns as a resident doctor, proving that where you start does not define where you finish. Welcome to the podcast.
Thank you so much for having me. I'm happy to be here.
Man, this is great. And congrats on the match, first of all. I know that's gotta feel so good.
Yeah.
I know what my match experience was like. Everyone's match experience is different. What was it like for you on match day? Walk us through that day.
The day alone, I think the week, from like Monday starting till Friday, it's a lot of nerves and anxiety that happened. Monday, I found out I matched, but at that point, I'm just like, okay, where did I match? It could be kind of, up in the air. I mean, I have my first choice, of course, but I was just so anxious. And I think you seen from that video of me like jumping up and down that I felt so much relief once I seen Yale. I think I read only Yale part. I didn't even read the rest of it, and I just started jumping. I didn't care what it said, what else it said. I just seen Yale, and I was just so excited. So it was an exciting day for me.
Amazing. You're right. Like the first thing is, did I even match? And there's some anxiety that goes away. Like, okay, good. And then it's like, oh man, really, where am I going to be? If you haven't gone through it, it's really hard to describe what that feeling is like. Obviously, we talked a little bit about the intro, but can you walk us through your journey? And I would love to hear how that affected your choice on specialty and where you wanted to go actually train for residency.
Yeah, so a little bit about my journey. I was born in New Haven, Connecticut. I was actually born at Yale, and I worked there for 10 years. So I worked there at 18 years old, fresh out of high school. And during my undergrad years, when I got my master's and right before I started medical school, I worked as a janitor there. And while I was working there, I also, cleaned the halls of the CEO. I cleaned a lot of, offices and a lot of different floors. And during that time of my undergrad of sophomore year, my mom got sick. And I think that kind of turned around like what I wanted to do with my career because I seen her deal with healthcare disparities when she was sick. And just seeing the CEO at the time help me when my mom was going through her disparities is what pushed me to want to become a doctor and help people that were like my mom. Interestingly enough, I did not go to medical school thinking I wanted to do anesthesia, even though my mom dealt with vocal cord dysfunctions. I didn't know I wanted to be anywhere near the airway, actually. I thought I wanted to do OB-GYN or something. So it wasn't later on into my medical school career that I decided I wanted to do anesthesia.
So you got anesthesia, you kind of found the calling, which was very deeply personal. I love that. And you got the interest in anesthesia, but then you start applying for programs and you had to start thinking, oh man, Yale, that would be interesting to go back to my former employer How did that journey go as far as applying and interviewing and ranking?
So when I first started medical school, I actually thought I never wanted to go back to Connecticut at one point because once we leave home, it's like I don't want to go back. I want to explore different areas, but something kept drawing me back to New Haven. Of course, my community and everything like that, and I'm like, I just have to be back. But I end up applying anesthesia, or thinking I wanted to apply anesthesia third year of medical school. It was pretty late, and that's when I started to get more information about what I needed to apply to anesthesia, started to look out for more mentorship. I actually did a away rotation at Yale New Haven Hospital around October of last year. And I think that really solidified that I wanted to be at Yale because I did other away rotations, but Yale just felt like home. I just felt like I needed to be back. I was in those halls and I was like, oh, okay, this is just natural for me. This feels normal. So it felt good.
Amazing. When you went back on the away rotation, did you see any of your former coworkers, and what was that reunion like?
Oh, yes. My sister actually still works there as a janitor. So I got to see her. I got to see a lot of my friends that I worked with because a lot of them actually helped me when I was in undergrad. They would like help me take like longer breaks so I can like study a little longer if I had an exam. So a lot of them see me from like, starting off earlier years. So they were super excited and just so proud of me.
What's really interesting is I think, and you tell me if I'm wrong here, I feel like residents and fellows typically, since we're in the hospital a lot, we tend to spend more time with the non-clinical staff of the hospitals more than the attendings do. At least that's my experience. So I'm very interested to see, like, is that true, first of all, from your perspective? But second of all, like, over the next several years, like, you're going to be part of a community that might be maybe have a chance to kind of build a bridge where there's maybe not so easy connections made.
Yes, actually, I've been talking to a lot of people at Yale, like a lot of my old managers in EVS, about having kind of like seminars or just like, Zoom calls or something where I can do where I kind of build that bridge with doctors and other healthcare workers. So in May, I'm actually talking to the EVS team about my journey to becoming a doctor and ways I can help them with whether they want to stay a janitor or if they want to do something else. So I definitely want to go in there and kind of build that bridge with communication, let them know like, hey, it's okay to come up to me and say hi, I'm just like you, I'm nobody special. But because I know when I was a janitor, I seen the white coats and I thought they were just untouchable. You don't talk to the doctors at all. So I'm hoping that I can kind of take down that wall that's there.
Man, I love that. And I like want to have this conversation again in a year and just hear about the residency experience. Very, very anxious. And you've kind of been all over like since the match and been on all sorts of shows and exposure. Like, are you getting crazy messages on social or people coming out of the woodwork? What's that experience been like?
So right now it's just been a lot of like interviews. Some of course I don't do because it's just don't relate to my story, of course, but mainly just positive things, which has been amazing. Like so many people have loved my story or want to interview me. A lot of, I've been on like CNN. I think last week I was on a show for Brazil, a TV show for Brazil. They reached out for an interview, and Spain reached out. So even other countries have reached out too. So I'm just like, I can't believe this story is touching so many people in different countries. So it's been positive in my inbox, thankfully.
That's amazing. I mean, there's the impacts that could be on so many people just of this making it more accessible. That's fantastic. I'm curious if you ever imagine yourself, I know this is like maybe different, but not going the residency route or medical school route. What were other things that kind of interest you and ways you wanted to apply your talents?
Crazy enough, I did not have a clue what I wanted to do before thinking about going the doctor route. I know when I was young, I wanted to be an actress, but that was far fetched. I don't think I knew anything about acting. But once I graduated high school, I actually took 2 years to just be in the workforce. Like that's why I did the janitor role. I just had no clue. I was either going to work or I was going to go to college. That was my household. And I was lost. I couldn't see myself in anything because that's just not what I was used to. My mom didn't go to college at the time, so I just didn't know what I was good at. I just knew I was good at school, but I didn't know what I wanted to do.
So with that experience you got, which I love, and I said this on the intro, I think before you came on, is in my experience with residents and medical students, is that the ones who have worked before in any kind of capacity tend to stand out in a few ways. And I'm curious on how you think your previous experience has informed how you care for patients.
Apart from being sympathetic, I just have that empathy for patients. Not saying that everybody can't be empathetic, but I was in those patients' shoes. Like I said, I've seen the hospital in every aspect, from being a janitor to my mom being a patient and dealing with those disparities to now being a doctor. So I'm in a lot of these patients' shoes. I come from the backgrounds that they come from. I come from the type of households that they come from. So I can understand them on a different level. I understand if a patient comes in and say, I didn't take my medication for a few months, and I can ask those questions as to why. Is it because you can't afford it? You don't have the transportation? What are those other reasons why you're not taking your medication other than they just don't want to? So I just think you have a deeper understanding of life, a little more, and that a lot of barriers could come in the way of patients doing the things that they need for their health. So a deeper understanding of things for sure.
Makes a lot of sense. I was just thinking, I interviewed actually at Yale for MedPeds in residency. That would have been 2013. I can't remember in your timeline if you were there at that time.
I started in 2011.
Okay, so we were maybe in the same hospital that day. And that was my first time ever in Connecticut, ever. I don't think I've been back actually. Not no offense to Connecticut. I just hadn't been back there.
No, it's okay. It's okay.
But one thing I wanted to ask you about is clarification of this like New Haven style pizza.
Oh, I was hoping you would go into that.
What is this? What is this?
We have the greatest pizza in the country.
I can't wait. Please tell me.
I don't want to hear anybody say New York, no Chicago, nowhere else. It is New Haven style pizza. We have the best pizza ever. And a lot of people did not believe me until they Googled and seen that we are top when it comes to pizza, but we have the best pizza. And if you come here, people will argue you down if you try to say otherwise.
Why is it good? What remind me the style? What makes it unique?
It's a thin slice, thin crust type of pizza. It's not oily like New York style pizza, and it's just so good. The sauce is amazing. It's just different. I can't explain it, but other than that, it's different. New York pizza to me is just too oily, and
Okay.
it's too big of slice.
Yeah.
I don't like that.
And Chicago's deep dish. I mean, that's it. So it's basically lasagna or like a casserole,
Exactly.
which is good. It has its place. Very interesting. Now I'm hungry, and if I see that in the menu, I'm gonna order it.
Well, I hope you come back and go get some pizza. You have to go to Modern Pizza in New Haven, Connecticut. They have the best pizza.
Okay, it's on my list. I will absolutely do that. It's funny because you think about residents, and we always ordered pizza late at night, or we had a lot of Indian food. Of course, the food in the resident workroom, which was like snack crackers and peanut butter cups. I'm guessing you guys will have delicious pizza then to order at 2 a.m. on an overnight shift.
Yes.
And I already mentioned this, but if you haven't gone through the match, it's hard to understand what it's like. If you haven't gone through medical training, it's hard to know what it's like. But for all those listening that haven't, which is probably not that many, it takes a lot of years. It's really arduous, obviously, a lot of debt. We talk about that a lot on this show. What is something that keeps you going through all of this? I mean, it's hard. There's so many. I mean, step one, step two, the match, obviously, residency will present its own challenges. What keeps you going through this?
It actually is a lot. I think a lot of people don't understand until they're in the process, especially if you come from a first generation family, right, of doctors. You don't know how much. Like, even now, moving for residency, I have a GoFundMe out right now just to help me with this moving process because I didn't know we only had a month to move and get ourselves together. But I think that the thing that keeps me going, of course, is family and my husband. He reminds me every day, of the work I put in and things I did to be here. But I always say all the time, I made this journey and what I want to do with my career very personal to me. And I tell, students that want me to mentor them, why do you truly want to become a doctor? Please don't say for the money, right? Because we know it's not an instant gratification. But I made it very personal to me, and my personal agenda was to help people like my mother, and that kept me going. I felt like I had to do that. Like there was a reason for me to start this journey, and that just kept me going the entire time and kind of put that battery in my back. That not saying I was here to save the world, but at least one person that was like my mother.
That's amazing. And I'm sure that's someone that you, just like with your husband, confide in during those tough moments.
Yes. Especially my husband. He knows all the tiers, the step ones, getting through that, step two. It's a lot.
It's also, I mean, for me, I liked having a spouse that wasn't in medicine.
Yes.
So like you can come home and you can like if you want to talk shop, you can, but you don't have to.
Absolutely. That was the number one thing for me. He actually was in the military, so he understands my schedule. Because he always compares it. He's like, it feels like, this feels like the military a little bit. So he understood my schedule. He would help me build my schedule so I stayed on top of things. So understood completely everything I go through.
I also like the other day was around several attorney friends and I heard them talking about a case and I like literally didn't understand any of the words they were saying. And I was like, this is what it feels like when people listen to doctors talk to each other.
Absolutely.
So I like going home and not having to at least deal with that, which is nice.
Yes.
I'm curious on your view on your experience, based on your experience. How has it shown you how hospitals actually function in a way that most med students don't see?
So when I started off as a janitor, I didn't know how important my job was. I'm gonna say that. I just thought it was a janitor role. It wasn't until I got to medical school that I understood how important it is to be a janitor in a hospital and how we keep those doors open. So I can say that my view of it is understanding the importance of cleaning those hallways and making sure that these patients are in a safe environment. And those are things that like I said, when I was a janitor, I didn't understand that was extremely important. And I think a lot of janitors don't understand how important their role is right now, being in a hospital. So I got to see that aspect of it. And I think another thing is I got to build these connections with patients on a different level than just being their doctor, right? I would go in as their janitor and I would just have regular conversations with them. Like one time I walked into a patient's room, he was watching Marvel. I love Marvel movies. And we just talked about Marvel the whole time. Another patient I remember specifically, she had cancer. She was losing her hair. And I spoke to her about, it was on in the bathroom at the time. And I had to clean the bathroom. And I asked her, I said, hey, do you want me to throw away your hair or do you want to keep it here? And we had a whole conversation about how important it was for her to keep her hair, there. So I got to have these deeper conversations with patients that I normally don't get to have every day as a doctor because we're so busy. We're so on to the next patient. We don't always have those deeper experiences. So I definitely feel like I got to understand my patients on a deeper level than them just going there for, whatever health issue that they had at the time.
What I hear you saying is in a way, it's like it makes it more humanizing for the patient. Like it's not like I'm a number and a set of labs and medication orders.
Yeah, which I don't think we as doctors see that way, but I think a lot of patients could think that way about us, right?
Yes, exactly, exactly.
We care, 100% care as doctors, but sometimes it could feel that way for patients.
Yes, like you said, when you don't have time and you have, 30 patients to see and in a hospital, it really stinks. It's hard to make that human to human connection. That's one reason why I like primary care. I found it easier to do that or outpatient medicine, which is not everyone's forte. But like I like that. And what was cool about hearing your story just then is you found ways to have that connection because it's like it's the worst experience for anyone to have to be in the hospital. It's scary. They're sick. It's one of the worst days of many of their lives. And when they don't actually get to talk to anybody, when it seems, even the nurses, there's so much work they have to do too. They're in and out trying to juggle. It's a reminder to be able to make the human connection and how important that is.
Exactly. And some patients come in without family. We forget that as well. And sometimes they're there for days without anybody. And sometimes their only connection is food service or patient transport or janitors because we have that time to talk to them.
Also, I will say in the hospital, I can think of several patients where we got great information like on clinical status from EVS, from patient transport that the nurses didn't know, the physicians didn't know, and we're like literally save people's lives because you're seeing them more than we are in a lot of ways.
Yeah. Oh my God. That's so awesome to hear because I truly want if anybody takes anything from my story, it's, people in those roles don't, your job is extremely important in a hospital. And I think if people understood that a little more, people will go into their jobs, excited to do their jobs a little more. And I think we forget that part is that everybody in the hospital is important.
Yes, 100%. I'm curious, one thing that's different probably for your training than when I was in training is how much social media is putting a spotlight on what it's like to train to be a doctor. It's more visible than ever. Do you think that this is actually helping those pursuing the career in medicine or damaging? It's revealing too much. What do you think?
I'm glad you asked that. I know there's a lot going on with doctors or med students being on social media. I think it's new for a lot of us now, especially in our careers. And it's kind of polarizing because a lot of people are saying, no, we shouldn't be on social media. And then we have me on the other side that I think that we're needed, right? I wish I had all this information around when I was going to be a doctor. I mean, I only had Google, which was good enough, right? I'm still here. But just some of the information that I get from these doctors online about the complete process, like step by step. I had to go through trial and error in order to be here. A lot of failures because I didn't know the complete process. But if I had TikTok or Instagram and these doctors are breaking it down, like step by step, everything I needed to do to become a doctor, it would have just made it that much easier. And I think it's like an easier access to find mentorship as well, right?
That's a great point.
Right. They reach out to me in DM now just to hopefully see about mentorship. So that makes that connection a little easier. So I'm for it as long as they are not harming anyone.
And I think your story is a great point in favor of why it's helpful because you're giving a story that most people, wouldn't have heard otherwise. And that inspires folks to understand how they can achieve it and seeing someone that's gone a different route. Like that's I think, a very strong pro in that column.
Yes.
If you could wave a magic wand and change one thing about medical school and medical education, what is one thing that you would change?
Oh, just one.
Just one, yeah.
I would say some of the toxic culture that can be in medicine. I know it's something that's always said, but just I see like with our schedules a lot, like a lot of people become overwhelmed with a lot of the hours. Like I see in students who lost family members and can't even go to the funeral because they're only allowed one day off per semester or something like that, or one mental health day. So I just think kind of the toxic culture that we have in medicine, where it's like this continuous workforce where we don't have protection when it comes to our mental health, especially residency, of course, too. I'm not there yet, but I hear so many stories of residents being overworked to the point that a lot of, they could be driving and they're super tired and possibly could fall asleep. I think the toxic culture needs to change a little bit.
Yeah. Do you think AI in medical education is making things easier, making workload easier? Do you think it's hurting people's ability to train to be a doctor? How do you see AI playing a role in medical education?
So I can't say for sure if it's hurting anything, right? I would have to maybe hopefully they come out with papers in the future to say, hey, this is the stats on it, right? But just only from my personal experience, I think that it has helped a lot, right? There has been things that, we can just go on open evidence and kind of put in and see, certain diagnosis that we don't understand, or even when it comes to step one learning and step two learning. AI has helped me a lot with passing those exams where I can make flashcards faster. I can take out all those, that middle ground work where I can just study a lot quicker. So, in my personal experience, it has made my medical education a little bit easier, but I don't feel like I'm learning less from it, if that makes sense.
Yeah.
And I know that a lot of attendings are like, well, you have to open a book in order to learn. I feel like that's our way of opening our book and still learning, and we still learn from our patients as well. So, in my personal experience, I think it has been great in my learning experience.
Yeah, I've heard someone say this to me recently that the practice of medicine is open book. That's just how it goes. We just have a more efficient book.
I love that. That's exactly what I'm saying. It's just more efficient, and it takes out a lot of the workload. I couldn't imagine. I mean, obviously people did it before me, but going through step one and step two, it just made it that much easier for me to just focus on what I need to focus on when I studied.
Does the hospital that you trained at in medical school or the OAs, did you ever go to the hospital library?
No. At my In my medical school, yes, but not any other way rotations now. So we study in our library at Howard.
Okay.
So we study there, but yeah, not at any other ways.
It's funny because there were libraries in the hospitals for this, for resources. Hey, I need to go read about this or see what the latest. And like every single time I went into one, it was just where people would like eat lunch and like take a phone call. Obviously, no one's pulling out a big book from 1994 and reading the latest on heart failure. And now we have, again, like Open Evidence, who takes all of these journals and condenses it in ways that makes it accessible. One thing I think is cool about it too, that I use it for, is to help translate complex medical diagnoses for patients. And I found that to be very helpful, whether it be radiology reads or, again, more like complex diagnoses. And how do I explain this on a message on my chart or something? And that I found that very helpful. You can't really find that really well in a book or old hospital library, it turns out.
Right. And then they give you the research behind it as well. Like you can't find it as fast, right? So, I mean, I love the steps that we're going when it comes to medicine, but I do understand a lot of people want to keep things the old way.
Yeah.
I'm just hoping that we can all move and learn more about it because I think we're just going to keep moving in that direction.
Have to, have to. I want to go back to the match for a minute, and we talked briefly about it, but can you just walk through for people who don't know the match process? We talked about the week, but and you find out that day, which is like a huge day, if you match or not. But what does it actually mean to match, and why does it carry so much like emotional weight?
Whew. Yeah, so I mean, that's 4 years of training in one day. I mean, you know best too. But I don't think a lot of people understand that this is 4 years of you putting in the work of doing a lot of research, making sure you pass step one, make sure you get a good score in step two, making connections, doing all these things just to put all that into one application and fill out, the form, the ERAS form and the application. And we apply to many schools, which can be extremely expensive, depending on if you apply broadly, which I did, of course. And some students are spending thousands and thousands of dollars just to apply and get a job, which we match at. And then the whole matching process alone is just a lot of students go unmatched, right? We know that's a fact, which is very unfortunate to do that training for 4 years and still go unmatched. So for students to go unmatched, I think that's the scary process for a lot of us. And it's a sign of relief when we do match. And that Friday, when you find out that you match as your number one, I mean, it's amazing. It's an amazing feeling.
Yeah.
It's a hard process. I would say that. It's a very hard process.
I totally agree on just like it's 4 years in one day. It's even probably longer than that too. I mean, all the work you did getting in, right? It doesn't matter if you get into med school if you can't match and ultimately go to residency and practice. Like it stinks to say that, but it's kind of true, unfortunately. So it's just so much pressure.
It is. I mean, it's 8 to 10 years, actually, if you really want to think about it. Like you said, the undergrad years is years before that. So it's just so much get weighted on that day, which it sucks that so many students do go unmatched. It's a process that I hope changes, but I'm grateful that I was one of the students that did match.
Yeah. I'm curious on, I want to go to the pre-med, just maybe think about pre-med. What's so interesting to me about pre-med, and people don't think about it this way a lot of times, but to successfully get accepted to a medical school, obviously you got to do great on your GPA and your grades in college and MCAT, but you also have to have like shadow experience. You have to have letters of recommendation and work with someone or research. Like all three of those things I just said are essentially unpaid labor. It's like you have to be able to go do a bunch of stuff for free. Therefore, then it cuts off that path for most people, right? And so I'm curious how you navigated that with working full time, going to school, and you had to get those letters of recommendation and shadowing experience too.
Which is crazy. And I think a lot of people, when they see my story, they get confused with the timeline because they're like, how is she working full time and doing all these things? Like, that's impossible. And I'm like, no, I was doing it on top of, taking care of my mom because she was in the hospital and going to undergrad full time. I can't tell you how. I truly can't tell you how I look back like, oh my gosh, how did I do this? But like when I was taking MCAT, I did take I think 2 months off of work, which I was able to do to study for that. So I did take time off of that. But I just literally my biggest thing is making schedules and making tight schedules. So if I know there's something that I need to get done, like say if I'm doing research, which I did do research in undergrad as well, I just kept a tight schedule. And I know that sounds like very bland, like oh my gosh, but that's how I keep things and keep things in order is just making sure I have a schedule, making sure each day that I at least try to fulfill those things on my schedule and get them done because I know I had a bigger purpose in this. I know I wanted to do this. So I can't say anything other than that. And no sleep, maybe. No sleep, but I can't believe I look back sometimes because I'm always so tired now as I get older, and I'm just like, I am tired from doing just one rotation. I can't imagine what I was doing before at 22, 23 years old. So
Well, I guess it's good practice for residency and the sleep schedule there, maybe too, but that's amazing. Seriously, that is amazing.
yes.
And like the finances are such a big impact. It's like you mentioned earlier, you ask people why they want to do medicine, and most people aren't writing in their med school admissions essay, I did it for the money. Like you're not going to get in, obviously. So some people tell the truth, some people are not. But for those of us that really tried to do this because we love the job, we found deep meaning in it, et cetera. Unfortunately, the money still plays a part in with the debt. And I'm curious on what is the financial reality most students, as you see it, aren't prepared for when they enter into med school.
I actually just recently made a social media post where I put my debt up there because I wanted to be so honest. I'm actually 590,000 in debt. And that's because I went to undergrad, I got my master's, and of course, medical school. So that's all of that accumulated. But the debt burden is huge. I think most students around $200,000 of debt. Mine's is on the higher end, but it's definitely a lot, especially if you don't come from a family of money, and you don't learn those things. Like you don't learn how to pay back those loans or how, finances or things like that. So I'm kind of learning as I go on, what I do when I start residency and, how to decrease that burden of my loans because I didn't learn that at all.
Yeah, it's unfortunately a tough reality. And I think the biggest thing I see is how do I go into residency? Well, first, how can I take out the least amount of loans as possible, which isn't possible for most to really do a lot because you got to like pay for gas and rent and milk. Like everything costs money and you got to use debt if you don't make money. But also, it's like, okay, I'm transitioning to residency. What do I do now? Because you're going to get that first bill from the federal government at least 6 months after res or graduation. So you're talking January, and people are like, oh my gosh, I'm just trying to survive intern year, and now I got to figure out what to do. Do you feel like you've gotten much guidance on that, or med students now getting more guidance on that?
They do give us a few seminars before we graduate that we have to take. They are mandatory, and they teach you about, paying off your loans, how to exit your loans, of course, and just all those things once you graduate. But I think for me, it's still hard to understand completely everything that comes with it, right? Because I understand that we'll have, certain choices that we have to pay back the loans, but until I'm in it and I have somebody there actually explaining it to me and not the entire class, I think I'll be able to understand it more because my experience is different from the next person. I do wish there was more like one-on-one coaching when it comes to those things, just because everybody experience is not the same. I might have way more loans than the next person, or, I might not be in the same financial, realm as somebody else. Like, it's different experiences. So I do wish it was a little more teaching.
And it's just changing so much, right? The payment plans are changing, the laws are changing, and you're just trying to like match and learn how to be a doctor.
So much more I don't know, honestly, to tell you the truth. And I have to do my little research like I normally do and try to learn a little more because there's so much I still don't know because I'm, going through onboarding right now and orientations and everything I'm trying to get done. I'm trying to move to my next state. So it's a little overwhelming that I think a lot of med students don't learn earlier on in med school.
Yeah, I mean, for me, I moved from UT, University of Tennessee, up to Ohio for residency, married with a one child at the time, and like that was real expensive. Didn't have any money, and already maxed out my student loans. So then I had to take out, basically use my credit card to move and find a place, and then you don't get paid till the middle of July, probably if at the earliest, right? So you got like 6 weeks of no money, but you still got to eat and pay for gas.
Still have to survive. And like I see a lot of students now are actually taking out GoFundMe's, and I seen in like my comment section of people are like, "Well, why would a doctor need a GoFundMe? They get so much." And I'm like, "No, you guys, I promise we don't. We are not."
Yes. Well, that is like what the first thing we did when we started Panacea was Ned and I basically went through that same transition. We're like, this doesn't make any sense why no one's trying to fix this at scale. And it's hard to explain to people who aren't in medicine. Like you said, like no one has any sympathy for a doctor. Like, okay, why do I care? Like, poor you. Like, well, I don't know if you understand. Like, again, I just mentioned 6 weeks of no pay, moving across the country. I had, whatever, close to $300,000 student loans at the time. Anyway, it's just, and it's not like I have time to stop and think, like, I don't think this, I'm not gonna do this. I'm gonna go just give up and go get a job. I just spent 15 years of my life and all this money. Like, you just got to keep going. And it's no matter what the cost is, unfortunately, you kind of jump through the hoops.
That is 100% true. A lot of people don't know. And like I said, that's why we need social media so people understand the things that, the residents go through because I don't think people understand. They just see doctor and like, well, you chose this career. And I'm like, I know, but I want to help you. But yeah.
Yes. That's a great point. That's a great point. Like connecting it with how does this apply to everybody in the community, right? Like not everyone's a doctor, but everyone's a patient or they know someone who's a patient. So you want a health system that produces doctors that want to work and stay working and enjoy their job to not get burnt out to ultimately hopefully provide great care. And that debt is just such a huge piece. I heard you already talk about you advocate or sorry, mentor a lot of pre-med students.
Hmm.
I'm just curious, like, what are those conversations like? And if you could just blanket send one text message to every pre-med student that gave them some sort of pearl or words of wisdom, what would that be?
Well, first it would have been mentorship, but I think that's why they reached out to me. But number one would be if you're listening in, is mentorship is huge. No matter what background you come from, definitely find a mentor, even if they don't look like you. Somebody that just wants to help you. Find mentorship. But another big thing is, as I stated before with my journey, understand why you want to do this because this is a long process, a very long and expensive process, as we talked about drastically. This is a very long process and it's not easy. It takes a lot out of you. So understand why you want to do it and know yourself going in because a lot of things are going to try to break you down. Just know why you came into it, know yourself, and know the personal story behind you, why you started. And hopefully that will get you through.
Yeah, that makes a lot of sense. It's just hard until you're in it to really fully see. It's just tough. It's a tough thing.
People can tell you all day, but until you in there.
Absolutely. Well, I wanted to move into I call it rapid fire. It's normally not that rapid because we start talking about stuff, but true and false statements. So I will say a statement and you tell me if you think that statement is true or is false and why. So I'll start with the first one. So, true or false, your social media presence can make or break a residency application.
True.
Tell me about that. Like program directors are like trying to scoop and find your social media accounts, and are they asking you about it, or like, what's that like?
So I believe that you want to be extremely careful with what you post. Just because social media is out there and doctors are on social media now, medical students are on social media is still very new to us in this career. And we still have an image to uphold, right, to our patients and people that look up to us. So I would definitely be careful of the things that you post. It's just our profession. Yes, we're doctors in a hospital, but we also are those people outside the hospital that people look up to and come to for advice. So I would just tell all students be careful. It definitely can hurt you. I think that PDs, program directors, are looking at social medias more now. And of course, they want people that they can hire that are, looked at it in a good light. So I would just be careful. I say post positively and be careful.
I saw some viral story of a med student influencer that posted some questionable content and that didn't work out too well, it sounds like.
And that's what I'm saying. And just be careful. You don't want to do things like post patient information, making jokes about patients. Like we work too hard to get here. And I understand that doctors always feel like we're kind of in this prison of we always have to watch what we do, watch what we say. But we did understand this when we signed up, unfortunately, that we are looked at outside of the hospital as well. So I just have fun with it, but also be positive on it.
All right, next is true or false. Burnout is inevitable in medical school.
I think true.
Okay, tell me why. Why do you think so?
The scheduling is just it's so hard. I mean, you can have hopefully a day to yourself. Mid fourth year, you can have some free time, but I think overall, it's just a very, very hard process. And I think every medical student goes through burnout at least once within his career, and I think it's just something that happens because of just so much work that we put into this. So I think it's kind of true.
All right, next is true or false. Serving as support staff previously will give you a positive edge as a resident.
True.
Absolutely true. It's absolutely true. 100% true. That's like the easiest true false ever. And we've talked a lot about it already, but I mean, man, it's just every attending is going to want you on their rotation.
Oh, thank you.
All right, next up, true or false. The medical system is fundamentally changing for the better.
Can I say in the middle?
Yeah, sure. Why not? Why not? There's no rules.
I'm gonna say maybe. I think some things are changing. I see a lot of people are rallying around, mental health awareness when it comes to doctors and residents, and but I think there's some things that still need to change, of course.
Yeah. It's a more lighthearted last one, true or false. The Pit is the most accurate TV portrayal of what being a doctor actually looks like.
So I don't watch The Pit.
Me either. Never seen it.
Okay. I choose not to do anything medicine once I leave, so that means I don't watch anything medicine on TV.
Me too. Never watched one medical show ever. Not one.
So we understand each other.
Yeah. People like The Pit's awesome. Like, man, it sounds great. It sounds cool. I'm not watching it, but
It sounds great. But when I go home, I don't want to think of medicine. I want to go home and relax, unless I don't have work.
yeah, I'm good with like Bluey or, something like that. No, that's funny. We're on the same page there.
Yeah, I'm a housewives person. That's helps me kind of like relax.
Everyone's got the thing, and I'm glad you found yours. That's good. I'm curious. I asked this question, it's our last question to every guest, but what is one thing that you have recently changed your mind about?
Recently,
It could be about anything, medicine, non-medical related.
I mean, the most recent is me going into anesthesia. That's the biggest life change, I think. I didn't know I wanted to do anesthesia at all, and that was very last minute. It was right before we were going to start applying for ERAS, so I think that's the biggest.
You were OB-GYN before that?
I was OB-GYN. At one point, I was even family medicine. I was just all over the place. And then I went to the OR and I met the anesthesiologist, and he was so nice. And we talked a little about his career. I shadowed him, and I loved it.
There you go. That's great. Well, that was amazing. You met that person and changed your career trajectory. Man, this has been great. Thank you so much for taking time out of your busy schedule to be here. Where can our listeners and viewers find more about you online and follow your journey?
Yeah. So my TikTok is Shay Taylor-Allen, and my Instagram is Shay with two Y's dot Taylor.
Well, Dr. Allen, thank you so much for being with us today and congrats on everything. Can't wait to hear more about residency and we'll talk soon.
Thank you so much.
Thanks.
Thanks for joining us this episode, and you can catch the podcast for Doctors by Doctors on Apple, Spotify, YouTube, and all the other major podcasting platforms. If you enjoyed this episode or learned anything here today, please take a moment to give us a rating and subscribe so that you don't miss a single episode release. To submit topic suggestions or guest suggestions or questions, you can reach us at podcast@panaceafinancial.com. As always, thanks for listening, and the next time you see a doctor, maybe you should prescribe them this podcast. See you next time.